Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for October 5th, 2020. And I want to start by acknowledging that we are here on the territories of the Lekwungen-speaking peoples, the Esquimalt and Songhees First Nations, who are the traditional keepers of these lands, and we're very grateful to be able to speak to you from these beautiful place here today. So today I'm going to give our update, and I will also be presenting an update on some of the epidemiology and the modeling that we've been looking at following over the last month. So that'll be our 9th, I believe, presentation of some of the data on COVID-19 in British Columbia. So as we are on Monday, we have 3 reporting periods to provide information on. From Friday to Saturday, we had 130 new cases identified. From Saturday to Sunday, 108. And from Sunday to today, another 120 new cases were identified, bringing our total on the weekend to 358 people who've been diagnosed with COVID-19, including 8 of which were epidemiologically linked. So our total in British Columbia now is 9,739. That includes 3,580 people in the Vancouver Coastal Health Region, 4,980 people in Fraser Health, 220 people in Vancouver Island, 548 people who live in Interior Health, 322 people in the Northern Health Region, and 89 people who generally reside outside of Canada. We now have 1,353 active cases in British Columbia, of whom 66 are hospitalized, 16 of whom are in critical care or ICU. We now have 3,010 people under active public health monitoring and 8,115 people who have recovered. Tragically, this weekend we saw an additional 4 people who died from COVID-19, bringing that total to 242 people. These are 3 people in the Fraser Health Region and 1 person in Vancouver Coastal. And again, these tragedies are compounded by the fact that we still cannot mourn in our ways that we usually do. And our condolences go to the families and to the care teams and communities who have lost people in the last week. We also have 3 new healthcare outbreaks in the province, a recurrence in Langley Lodge, in White Rock Seniors Village, and in Chartwell Crescent Gardens, all of which are in the Fraser Health Authority, and all of which have been a single case identified in a healthcare worker, and we have teams on site to make sure all of the appropriate protocols are implemented in those facilities. In addition, the Holy Family Hospital outbreak has been declared over. We now leaving us with 19 active outbreaks in the healthcare system, 16 in long-term care and assisted living, and 3 in acute care units. And 876 people have been affected, 517 residents, and 359 staff. Also over the weekend, 1 new community outbreak was declared in the Fraser Health Region, and that's the MSJ Valhalla Distribution Centre, where a number of people have been identified, and case finding and outbreak management protocols have been put in place in that workplace. In addition, there have been other smaller exposure events, both in schools and in workplaces and in other sites in the community, and these are listed on the Health Authority websites and on the BC CDC website. So with that, I'm going to move into our fall update and present some of the data that we've had in the past little while. So what we're talking first is the epidemiology, so that is the person, place, and time of how this virus has affected our populations here in BC. And this first slide gives an update on the geographic distribution of COVID-19. This is by health service delivery area of our case of residence. And as you can see, in the past 14 days, we have had cases in all areas of the province. The focus, however, continues to be on the outbreak in the Lower Mainland, with the Fraser Health and Vancouver Coastal Health regions and the HSDAs in those regions having the majority of the cases. Our weekly profile, in the past week we had 667 new cases identified, and as we have seen throughout this, about half of them have been female. Our hospitalizations, we had 52 new people admitted to hospital, and bringing our percent of cases who require hospitalization 8%. That is significantly down from earlier on in this in the pandemic, when as many as 20% of cases were hospitalized, and again reflects the fact that we're doing much broader testing in our community now. And in addition, we've seen a change in the demographic in people who've been affected, with much more younger people being affected, and the median age of people in hospital has also come down. Our deaths continue to be overly represented in people who are older, with the median age being 85. This is the epidemic curve, and that is the curve by when the laboratory test is done, so what we call reported date. And as we can see, there's a bit of a periodicity to that, where lab tests tend to be clustered on certain times of the day. But as you can see as well, we've had an increase in numbers of people who've tested positive since July. And the next slide is the epidemic curve by date of onset of illness for most people. And this gives us a better idea of when people have been exposed and where they've been exposed, and it helps us look at where these exposure events have been happening. So the majority of cases, as we can see from this, are related to local acquisition. So still over 80% of cases every day, when we do the contact tracing, we do the trace back to find out where they've been exposed. It is mostly people who have a known contact who's positive or are part of a cluster in BC. And the other, we still continue to get international travel, so cases in people who have returned from India. Most recently, we've seen a number of cases, and we still have temporary farm workers who are coming in and occasionally end up developing disease while they're in quarantine. The next slide tells us about the number of cases in hospital, and as you can see, we've gone up since our nadir in August, but we've leveled off, and we have a consistent lower number of people in hospital now than we did earlier on in our first wave. The same can be said about the number of people who are in critical care in British Columbia, where the number is smaller and it's leveled off. We continue to see people requiring that level of care on an ongoing basis. I wanted to talk a little bit again about the age groups of people who have been affected in British Columbia, primarily in the last month, as we've seen things like schools restart and people going back into work. So we continue to see that the majority of cases, or the age group that's overrepresented now, is the 20 to 29 and 30 to 39 age group. So that's the yellow bars compared to the blue bars. Where we also see is that the population under age 10 is about 10% of the population and only represent less than 5% of our cases. And the population 10 to 19, again, is underrepresented, even though we're doing increased testing in that age group in the past month. So this slide puts it in a little bit more detail around hospitalizations and critical care and people who've died from COVID-19. And what we can see is that very few young people under the age of 19 require hospitalization. We've had no young people who've required ICU care, and thankfully we've had nobody die in that age group. Hospitalizations are less than 1%. Now I want to provide a little bit more information about what we've been seeing in the back to school update and how we've been monitoring young people and all of the people who have gone back to school. As we know, about 500,000 students, educators, staff are back in our schools across the province since early September. And we also know that some students, educators, and staff have tested positive for COVID-19. But, like earlier in our pandemic, children under the age of 18 or 19 still make up less than 10% of our total cases in the province. So what we're not seeing is schools amplifying transmission in the community. Our testing rates, however, have gone up, particularly for young students. So they're 4 times higher for children age 5 to 12 and 2 times higher for our teenagers who are in the school age. 2/3 of the tests now are the spit and gargle test, which makes it quite a bit easier for young people rather than having a nasopharyngeal test. And really, our rates remain low in this age group, with only 7 in 1,000 tests being positive for COVID. And as we know, many children are requiring a test because they have symptoms, and this tells us that there are other things causing those symptoms that are circulating in our communities right now, including some of the cold viruses and regular things that we see this time of year that can cause coughs and colds and runny noses and fevers in children. And some of these can be transmitted much more easily than COVID. We have had, as we know, a number of exposures in school settings, and there have been, up until October 1st, there were 50 that were reported, and those are all on the BC CDC and the local health authority websites. As you can see, they're half and half between elementary schools and secondary schools, and majority are in the largest school districts, so in the Fraser Health region and Coastal Health. And there has been an update. We've had another 14 exposure events that have been reported since the October 1st, and including the first one on Vancouver Island this weekend. If we look at our cases in school-aged children, by the week of report, we have seen an increase, but it has leveled off, and it's not been a large increase at this time. Most of the school exposures are also related to exposure events that happened outside of the school setting, and we know that from especially early on, where people were unrecognized and then spent some time in the schools. And so we'll be monitoring very carefully now that we've moved into past that first incubation period, and we'll continue to work with schools to identify any exposures. What we can see, though, is that the proportion of COVID-19 cases by week in school-aged children remains low and less than 10%, and that has been consistent in the 3 to 4 weeks since schools have opened. This is our summary of laboratory testing, and as you can see, our testing rates have gone up quite a bit, 15% from last week, with over 50,000 500,000 specimens now tested. So this means that's all of the tests that have been done. 10,000 total positive specimens. Some of those would be more that one person may be tested more than once, and we know that it's about 9,000 in some actual individual people, but our positivity rate remains low and less than 2%, at around 1.6%. And just for this past weekend, our number of tests were 33,409 tests, so over 10,000 tests a day over the weekend, and with 351 positive tests for a test positivity rate of 1.04%. One of the things that has been a challenge as we've increased our tests is the turnaround times in the lab, and it has increased slightly to around 26 hours on, or 28 hours on average. Just to give a little more detail around the testing by age, this graph shows us the positive rates and testing by age groups. And as we can see, the 0 to 4, 5 to 12, we've dramatically increased the amount of testing that's done in that age group, but the percent positive, or the test positive rate, remains very low in that group. And that tells us that most people do not have an exposure that has been related to COVID, which is good news. Where we see the percent positive rates being high and staying high are in our older age groups. And again, those reflect the fact that many of these people are part of an outbreak investigation and are tested because they are in a long-term care home or hospital. So So the next part we'll talk about is some of the update on our modeling that we've presented before. And first is what we call the reproductive number, so the RT. And on average, this shows us that we have slowly come down in the number of infectious contacts that each case generates. And what we've come down slightly below 1, and we're hovering just under 1, which is where we want to be. That means that we are having connections in our communities. We are opening schools, people are going back to work, but we're having safe connections. And so on average, fewer infections for each case in recent weeks. And each case is now transmitting on average to fewer than one person. What we do know about this virus, though, is that for most people, they will pass it on to one or less people. But sometimes for reasons we don't know, we get people who shed a lot of virus, and they have potential to spread it to large numbers of people. And what we saw tipping the balance a few weeks ago was when we took measures to try and reduce those environments where people can inadvertently spread it to large numbers. So closing of the banquet halls, closing of nightclubs, closing of those environments where we were seeing transmission events happening, sometimes in large numbers to people. So it's made a difference. The other thing that has made an important difference is people in British Columbia doing what we've asked them to do. And this next slide shows this. This is the dynamic compartmental modeling around trends that we've seen before. And we were seeing, the last time we presented, that our curve was going up again. And what this tells us is that that increase has slowed and is now turned and is coming down again. So our growth rate is decreasing, which means that we are having safe connections in our communities now, that people are doing the right thing, that we have our COVID safety plans in place in schools, in workplaces, in restaurants, and that they're making a difference. So our number of contacts that we're having where we can potentially transmit the virus has decreased. This is incredibly important, and it's a testament to the work that everybody has been doing in BC. It also reflects the fact that public health has been working very carefully with every single case to identify the exposure events, to make sure that people who have been exposed, who might develop illness, are isolated safely and supported. So when they do develop symptoms, if and when they do develop symptoms, they're able to be cared for properly and not pass it on to the next person. So we know that we are at a place where we're somewhere around 45% of the contacts we're having have the potential to transmit this virus. That's where we need to stay. This is what will keep us on this low and slow curve through the next few months, particularly as we go into respiratory season. We still have large numbers of people who are identified as testing has been ramped up and as we're doing the contact tracing. But we all need to continue to do our part to keep our groups small, to make sure we're wearing masks, that we're keeping our safe distance, and we're staying away from others if we're sick. And these graphs present some of the scenarios that are possible should we let our guard down again and start to see increased risk of transmission in our communities. Oops. Finally, I want to present again, some representations of our curve and where we've been compared to other jurisdictions. And this first one looks at our case rates and the pattern that we're seeing in BC compared to some other provinces. And as we can see, we're sort of grumbling along. We had been increasing and we're now leveling off. Right now, Quebec is at a rapidly increasing rates. We're seeing Alberta being very similar to us at a slightly higher rate. Unfortunately, Ontario, Manitoba, and Quebec are starting to see rates that are going up dramatically, and we've seen that reflected in the measures that have been taken in those provinces. The next slides are a series that shows our newly case rates and our daily death rates compared to other jurisdictions. And as we can see, we're keeping our curve flat and low compared to many other places. But we are not out of the woods. We need to ensure that we keep it this way as we move into the respiratory season in the coming weeks. And finally, this is the same data reflected compared to other provinces in Canada. We had been moving up, and we've now cautiously started to turn that corner. We've started to flatten our curve. We've started to do the things that we know will help us get through these next few months together, and that was to keep our curve, to bend our curve back down. So there are a few takeaways, as I've mentioned, from this modeling. We are flattening our curve, and it's the work of all of us and the actions that we're taking as individuals and as communities that is making this difference. And it's important for our health of our communities that we continue to do this so that our businesses can stay open, our restaurants can stay open, our schools, our all important schools for children can stay open. And it's through our contact tracing we've seen that the majority of new cases are still connected, that we're not seeing a lot of uncontrolled transmission. As many of us are thinking ahead, particularly to this next weekend, to Thanksgiving celebrations, new guidance for safer celebrations is now available on the BC CDC website, and it talks about Thanksgiving. It also talks about some other upcoming activities, including Halloween, and there's some guidance on Halloween, on how we can have other important ceremonies like Remembrance Day safely as well. This year, I encourage everybody, make our celebration large in thanks, large in gratitude, but small in size. As we saw this summer, traveling to other communities can sometimes mean we bring this virus with us. So instead, while many of us would often travel to friends and family, whoever our family is, to spend time together, this weekend, stay close to home. Have a small gathering instead, and reach out and include those friends and family in a way that is safe, and that means virtually for many people. Limit your time together inside prior to or following your meal. Seat guests as far apart as you can. Opt for individual servings instead of a buffet, reducing the chances of mixing. And don't share food and drinks. And always, always remember, if you're feeling at all ill, show you care by staying home and away from others. This has been a difficult few months for all of us. And each day and each month that everyone has chosen to do the right thing, we're helping to protect our communities, to keep our communities healthy, to keep our workplaces open, to keep our schools open, to keep supporting each other so that our surgeries can happen, that we can protect seniors and elders in our communities and in our long-term care. Our actions today have a direct impact on how our province will fare next week and the week after. What we do for Thanksgiving will make the difference for the fall, for Halloween, and for the next important celebration after that. This weekend, give thanks to your neighbors, your friends, and family for doing their part to keep us all safe. We are stronger together by staying apart. And let's continue to find new ways to support each other and show we care at a safe distance. And let's, of course, continue, as we have been doing, to be kind with each other, to be calm, and to be safe. Thank you very much, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone line, please press *1 to enter the queue. You are limited to one question and one follow-up. Please also take your phones off mute. You will not be audible until your name is called. First question today is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. We've learned that on Saturday, Vancouver Coastal Health ordered a full class to self-isolate at Elsie Roy Elementary in Vancouver. Can you tell me how many times a full class of students and staff have had to self-isolate since September began, and what would make this necessary as opposed to just asking close contacts to self-isolate?
I don't have the exact number, but I know there have been several full classes that have been asked to go home, both in Vancouver Coastal, in Fraser Health, and also I'm not sure exactly where, but it would depend on the age of the children. It depend on how long somebody was in the infectious period when they were in the class and the activities that the class was doing. So there are a number of different reasons why that may be. So it could be whether it was a student or a staff person who had contact with whom, the types of activities that the class engaged in.
Do you have a follow-up, Shannon?
The infectious period, parents were told, was nearly 2 weeks ago, but the order for the whole class to self-isolate only came on Saturday. Isn't that too late? The students were kind of living as normal for the first 10 days of the 14-day isolation period.
Yeah, so that's the reality of how we are able to find people and do contact tracing. So that meant that by the time this person was identified as being positive, so there's many reasons for that. I mean, we don't have a way of knowing everybody. So the person was, usually what would happen is somebody develops illness, they're at home, they get a test, but there may be a delay. They may not have realized it was symptoms that could be suggestive of COVID. They may have been at home for other reasons, and then a test was done, and it was recognized that the onset of their symptoms was at a time when they were still in school, and so the infectious period. So yes, what that means is that we would follow up, public health teams will follow up with every single person in that class and make sure that nobody else is sick right now. So it becomes a little bit of both case finding and isolation because we're near the end of that incubation period. So there may very well be some of those students who were exposed on the in late September who have themselves developed some illness, and that's what public health investigations will do as they became aware of them this weekend.
Next question is from Richard Zussman, Global News.
Around that issue, Dr. Henry, Caulfield Elementary has had now multiple exposure dates. You explained this last week, but I think there's still confusion out there around what exposure events mean and the spread of the virus inside of a school. Is there still concern about the possible spread of the virus at Caulfield Elementary? And have you spoken to parents at that school who have expressed concerns to you around how the situation was dealt with there?
Yeah, so no, I've not spoken to parents at that school. Obviously, Vancouver Coastal has been in touch with parents and with the school and with the school administration on a regular basis around what's happening in that school, and all of the exposure events that have been determined by that ongoing investigation have been reported publicly by Vancouver Coastal, and importantly, I think, and essentially, Vancouver Coastal and all of the health authorities, the public health teams on the ground with each school will contact every child or parent who's been a contact within that setting, and all of the teachers, admin staff who also had been in close contact. So that will happen in addition to the public notification of the exposure event.
Do you have a follow-up, Richard?
On Halloween, you mentioned the CDC now has the guidelines out about Halloween. You know, some of the things mentioned there is using tongs or baking sheet. You know, what should parents take out of this guidance around what message you're trying to send about how to do a safe Halloween?
You know what? I think it's the same as for many of the things that we're dealing with through this period, and we'll continue to deal with. And I've had questions already about Santa Claus, and I really believe that Santa Claus will know how to do this and do it safely as well. But in terms of Halloween, what we want to do is have small groups outside as much as possible, and instead of having children reach into a bucket or something, have it outside where they can pick it up individually. something like that. These things can be done safely, but I also think we need to pay attention to some neighborhoods, some communities, some houses, some apartment buildings, or some of those events that we're used to may not happen this year. There may be streets, and I've had some communications from some groups of neighborhoods who've said, we generally do a big thing and thousands of people come, but we don't want that this year because we don't feel safe. Or we have a lot of seniors in our community and we don't want trick-or-treating in our community. And I think we need to respect that. We need to realize that this is another one of those things that's going to be different this year. And we have to do it in small numbers. And I also know that there's many inventive ways that parents and children are looking at having Halloween celebrations, and I've had a couple of really neat ideas from young people about how they can do it safely. So I think there's lots of good advice on the BC CDC website, but let's be respectful of each other and mindful that not everybody wants to participate in that celebration this year.
Lisa Cordasco, CHLY.
Thank you. Good afternoon, Dr. Henry. You've reported 11 cases on Vancouver Island over this weekend. That is one of the larger jumps we've seen. Can you tell us whether these cases are related or are they various individual cases?
Yeah, there's a number of them. Some of them are related, some of them are travel related, and most of them are individual cases in a number of different communities on the island. And Island Health is following up with individuals, and as we're aware, one of them is related to a school exposure event.
Do you have a follow-up, Lisa?
I'm wondering about the diagnostics ID Now test that's been recently approved by Health Canada. Will this test be used in British Columbia, and who will decide whether it is used here?
So I didn't quite hear, but are we talking about the Abbott point of care test that was last week?
Yes.
Yeah.
Yes.
Yeah, so we do have a laboratory advisory group that looks at where to best place different technologies. We have a number of different lab platforms, they call them, in different parts of the province. And this one is not a high throughput, so it does small numbers of tests per day. So, but it is a self-contained unit, so you don't need to have a lab like in a hospital or the BC CDC. So we are looking at where they'll be deployed. But right now, we're thinking the most value will be from having ready access to this type of testing in our more rural or remote communities, including First Nations communities. So that's the strategy we're working on, as they should start coming online in the end of this month.
Next question is from Tina Lovegreen, CBC.
Thank you so much. Dr. Henry, 7 patients have died at Delta Hospital due to COVID-19 since September 16th when the outbreak was declared there. How could 18 patients and 17 staff members become infected, given all the layers of COVID controls in place in a place like a healthcare setting?
Yeah, that is a question, and it has been a very challenging outbreak again. Like often happens, it's unrecognized cases that spread that cause the biggest challenge in our healthcare system, and we've seen this in some other healthcare facilities as well. So there's a number of different factors that have led to the spread at Delta Hospital, but tragically it has, as you said, involved 7 people who've died. There's ongoing transmission that happened in a number of different settings to healthcare workers and between healthcare workers. So that is something that Fraser Health is working closely with Delta Hospital on, and it is a very challenging outbreak for sure.
Tina, do you have a follow-up?
Yes, please. We understand the outbreak is contained to the 2nd floor and the entire hospital is closed to new admissions to protect patients. Is doing that the right way to stop the spread of the virus at the Delta Hospital or hospitals in general? Thank Thank you.
Yeah, absolutely. We want to reduce the number of people that are in the facility so the potential of exposure is reduced. But I think the other important thing to recognize is that there's been quite a lot of healthcare workers who've been exposed, and many of the as well who are now off and self-isolating because of those exposures. So there's the cases that are positive, and then there's the people that they've been around. And this is something that we've seen in other healthcare settings, that that PPE is worn appropriately in carrying in patient care areas, but sometimes we are not as good at keeping that up when we're in our office setting or in a staff only setting. So it right now, part of the challenge is staffing healthcare workers who are home self-isolating because of exposures. So the emergency department is open, but the hospital is closed for admissions right now.
Next question is from Lisa Houston, News 1130.
Oh. Sorry, just taking it off of speaker. Thank you, Dr. Henry. Regarding schools, clusters, outbreaks, why can't health just say how many people have tested positive in a school and if they are adults or students? Because it's not sharing of information, isn't stopping people talk about it, it's just preventing accurate information. One parent telling me, but I don't care if it's a cluster or an outbreak or a watermelon, I just want to know how many cases there are in my school.
Yeah, I know it's challenging, and we have to find that balance that allows people, that doesn't identify people and make sure that people are confident that they're going to be protected if they have been a case, if they've been exposures. So we have to be careful on how that is given out publicly. We do know that some students and parents and teachers have shared information, and sometimes that is perfectly appropriate for them to do. But we've also known that some students and teachers and staff who have shared information have been the recipient of nasty notes and bad behavior, and that makes people very concerned and afraid to share their information, and in many cases reluctant to go for testing or to engage and let people know what's going on. So we have to find that balance. Right now we are posting all exposure events and the days they occurred, so people know the small number of schools compared to the 2,000 and some schools that we have in the province that have had somebody who's been in their infectious period in the school environment.
Lisa, do you have a follow-up?
Yes, I don't think that's quite answered why you can't put numbers at schools, because you could still do that without divulging who these people are. And I think the lack of confidence is coming from lack of information, not from too much information. So I'm wondering what steps are being taken. You talked with me last week about, that there has been missteps at best in communication. So what can you tell parents is being done to improve that communication? Because parents, there's a lot of them that are feeling that they're not getting the full picture, and it's making them lose confidence in a public health approach.
Yeah, and I actually think that parents are getting the full picture. And as I've said, the public health teams on the ground are working with every school community, every parent who needs to know what's going on with their child has that information. And what we post publicly is every single exposure event. That was the concern, that there was some of these events that were not being publicly posted. And I can clarify that communication glitch has been resolved, and we are all, every health authority, and it's all on the BC CDC website, is posting every school exposure, the date of that exposure, and what school that exposure occurred at. I can say as well that we have definitions for what an exposure event is. The priority for the public health teams, of course, is to notify those students, staff, teachers who were close contacts of that exposure event, and to make sure that the school community is aware that we are there. We're working with the school community, making sure that everybody who has been exposed is notified.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon, Dr. Henry. Thanks for taking my question. You mentioned, I just want to go back to your focus on the younger demographics, 20 to 39. and their disproportionate share of cases now. Could you tell me what we know about workplace exposure, so people who are exposed while working in restaurants versus people who are, or other businesses versus people who are patrons or visitors?
Yeah, so I don't have the exact numbers, but we do know that that demographic, especially the 30s to 40s, is also the healthcare worker demographic. So a good proportion are those, and we've had some large workplace exposures and outbreaks, and that includes the most recent one where there was a number of people at the Valhalla processing plant. So yes, we do see it in workplaces. They're mostly small numbers now. We were seeing exposures for staff who worked at some restaurants, but primarily it was at the nightclubs, bars, and banquet halls that we were seeing staff being exposed. Restaurants have been pretty good since the late night has been curtailed some. We also see clusters of cases in some office settings and other workplaces, but they tend to be much smaller. It's those larger workplaces where people are together over in close quarters, so the poultry processing plants, the fruit processing plants, and also settings where people are living in communal accommodations. So places like our initial outbreak we had in the temporary farm workers in their accommodations. I will say, though, that we've put an emphasis on the COVID safety plans that we have in those workplaces, and we did, as you may recall, in June, July timeframe, looked at and worked with WorkSafe BC to make sure that all of the processing plants had good COVID safety plans in place, that workers had the personal protective equipment they needed, that barriers were put in place, that there were measures taken to reduce the transmission risk in those settings, and that work continues. The environmental health officers in the health authorities are working with WorkSafe BC on those types of measures. And we can get an update to you about the proportion in different areas, but when we presented that last time, there was about a third of cases in younger people in particular that were related to parties and events. I don't know how many of them were workers at those events versus people who participated in the event and may have worked as well.
Moira, do you have a follow-up?
I do, thank you. My next question is about hospitalization and types of illness in young people. Have we seen people in that under 40 or under 50 demographic requiring critical care or hospitalization, or are we seeing more mild illness?
Yeah, so we have seen people in their 40s and 50s definitely being hospitalized, but at a much lower rate than what we see in older people. We know as your age goes up, the risk of having more severe illness goes up. Having said that, we have had 3 people in their 40s who've died from COVID-19 here in BC. We've had nobody who's been younger than 40 that has passed away from COVID-19, and we've had a small number of people in their 30s who have required intensive care. But the risk goes up quite dramatically, and I think if you go back and look at slide 9, it gives you a sense of the proportion of people in each age group that requires intensive care.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. Based on the chart that shows the sources of infection, there appears to be quite a few cases now, or at least as of September 30th, whose sources are unknown or pending or missing exposure information. Is there a backlog or a delay in the province's contact tracing abilities, and if not, what is the explanation for that?
Yeah, so no, there's not a backlog or delay, but it does take some time. So every single positive case is contacted. Our rates right now are still within 24 to 30 hours. So within the next day, whether it's a weekend or any day of the positive test being reported, and that continues to be quite high, but sometimes it can take some time to piece together exactly who was in contact with who, particularly if it's the first case that's identified related to a cluster or an outbreak. So we have different ways of doing contact tracing and what we call social network analysis to help us understand where people might have picked it up. And it's really important to figure that out. And we still have been consistently able to figure that out in 80% or more of our cases. And I think there's two things that tells me. One is that we're keeping our numbers low enough that we're able to do that. And that's a testament to what everybody is doing in BC to have smaller numbers, to use protections. But it also means that our contact tracers are very good and skilled at being able to put those pieces together and find out where people have been infected. And then we also look at, well, who have they been in contact with since they were infectious themselves, and making sure we can find those people within a short period of time. So we are working very hard, and I know my colleagues across the province, but particularly in the Lower Mainland, they've been hard at this for many months now, and they're very good at it, and it's one of those things that's helping us keep that curve down.
Do you have a follow-up, Brishti?
Yes, thank you. My next question is about Island Health Region. Quite a few people on Vancouver Island are still regularly reaching out to us, letting us know that they're having to wait hours to book a COVID-19 test, and then several days before they get an actual test administered. Is there a timeline for when these issues are expected to be resolved?
Yeah, I really wish it could be. The timeline is, of course, as soon as we possibly can. I know they're looking at many different strategies to try and improve that, including bringing on more people to be able to man the phone lines, making sure that the testing sites are expanded hours. But it is very much a challenge that came on more quickly than expected and quickly overwhelmed the system. But I know they are actively working on that. I'm afraid I can't give an exact timeline.
Keith Baldry, Global News. Okay, we'll come back to Keith. Next question is from Jane Side, North Shore News. Jane, are you there? Okay, we'll try again for Keith.
Sorry, I was on mute. Sorry about that. I'm still getting questions from parents in West Vancouver who are wondering why they can't have additional transparency in terms of being notified when somebody in their kid's cohort has a positive exposure, and they're wondering why siblings being allowed to go to school. So,
There.
Can you repeat your question?
Hello, can you hear me?
Yeah.
Hi, I was asking about parents' concerns in West Vancouver, and they're asking for more transparency in terms of notification when somebody in their child's cohort has a positive test, and wondering why they can't be notified.
And as we've talked about, each health authority is notifying of any exposure event in every school.
Jane, do you have a follow-up?
I guess the parents are asking for, a more, a narrower frame of reference in terms of not just the school, but if they have a kid in grade 7, that they would know, for instance, that their kid in grade 7, there was a kid in the grade 7 cohort who had tested positive, as opposed to just the whole school.
So the cohorts that are affected, if there's contact in the school, if there's close contact, and we have to remember it's not just the kids who are being infected. So there are teachers, there are staff, there are support staff that have also tested positive in the school setting. So students and parents are notified when there is an exposure event and if any of them are close contacts.
Okay, we're going to try again for Keith Baldry, Global News.
Hi, Dr. Henry. Thank you for this. I hope you hear me. Just don't want to belabor the point, but back to West Vancouver and Caulfield Elementary. A letter signed by close to 900 parents has been sent to you and Dr. Pat Daly, not so much about information being shared, but they want you to change the protocol of isolating the entire cohort immediately and not wait for contact tracing. They say promptly disclose exposure events and isolate the entire cohort immediately, and please include siblings in the isolation strategy, even though this will mean more kids are having to self-isolate on a much more immediate basis. Strikes me that 900 parents signing something like that signals some sort of serious alarm out in West Vancouver.
Yeah, and it does absolutely reflect, I have not seen that, but it clearly reflects concerns that weren't helped by early miscommunications perhaps. But I think, we need to recognize that our overriding goal is to ensure that kids are safely in school. What we have seen and what we continue to see are very low-risk exposure events and very few, if any, transmission events in schools. So we are able to effectively determine what type of contact people are having, what type of risky contact there is or not, and to limit the number of people who have to self-isolate. And we've been very effective at that. We've not seen where public health has asked people to self-monitor and where they've addressed close contacts, we're not seeing outbreaks happen in schools. So these are the things that we are watching for. When public health makes their recommendations and people are notified, the transmission has stopped. So that's the effectiveness of the measures that we're putting in place now. And we need to balance that on the disruption of large numbers of students for no reason. These are the things that we need to think about as we're going into this respiratory season. The vast majority of symptoms are not COVID. And when young people or student staff or teachers, educators in the school system have a case of COVID and there's been exposures, the other measures that we have in place to protect people in that school environment are working. We have not been seeing widespread transmission, and that's what really important thing to know. And public health teams are working with every single school around every single event.
Do you have a follow-up, Keith?
Yes, back to the overall modeling. Last week we asked you if you were optimistic about going forward, and you said you're not one for being overly optimistic, but you were cautiously optimistic. Now that we've seen the modeling that you presented today, are you significantly more optimistic that we are bracing ourselves for a more positive situation come the fall in the coming months?
Well, I think what this shows us is that we've done the right things, and people in BC have taken the measures that we need. And at the same time, we're keeping our schools open, we're keeping many workplaces open, we're trying to find that balance that's going to get us through the next few months. But we can't be complacent, we can't let off, we can't start increasing risky contacts right now, because we know we're headed into respiratory season. We're already seeing that, where there's more people with runny noses and coughs in the community right now. So this is what we all need to do now. We need to be careful this weekend, Thanksgiving weekend. We need to keep our groups small. We need to avoid unnecessary travel like we did in the spring, because we know that we can bring this virus with us. And it is travel even within BC, but particularly having people come in from other provinces, other places in the world where we know that is risky as well. So now's our time to keep this balance. We need to stay where we are, and we need to support each other to get through the next few months. And that's what's going to make this work. So I am optimistic. I'm heartened that we know what we need to do. And now we need to give each other the courage and the support and the compassion that we're going to need to get us through this next few months.
We have time for one more question. For everyone listening today, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Shannon Waters, BC Today.
Hello, Dr. Henry. I wanted to ask about the public health guidance for people who work in an office setting currently. I'm hearing more reports of employers who are telling all of their employees that they need to be back working at the office full time. And I'm wondering if that is consistent with the current public health messaging around working in an office setting.
Yeah, so I think it depends on the office setting. So for every setting, you should have a COVID-19 safety plan. And for the office setting, there's no difference. We have it for the public service, for every building that we have in the Ministry of Health. Every office needs to have that plan. And if that plan has ways that people can fully come back safely, then that is what you need to have in place. And some offices can do that. They've put in barriers, they've put in physical barriers. I do think that we need to remain flexible in order to support parents with children in school, for example, and other caregiving responsibilities that we may have through this pandemic, knowing that we're going into respiratory season, as we've been talking about. But as long as we have those plans in place and people are supported to be able to safely come back to an office, there's no limit on whether people need to be back full time. But I will say, we do encourage people to be innovative, and we've seen lots of this where we have small pods, so you're not meeting with large numbers of people, similar to what we're doing in schools. It's a very effective way of trying to reduce risk and reduce transmission. And so making sure that you have either the appropriate space between desks, if you will, or workspaces, that you are able to have remote meetings so that you don't have lots of people together in a conference room, for example. So those are all the things that need to be part of a COVID safety plan for an office environment as well.
Do you have a follow-up, Shannon?
Yes, please. And apologies if I missed this with your comments off the top. I was a little late into this briefing. But I'm wondering, again, on the Thanksgiving front, I'm seeing people sort of talking about or wondering about, can my Thanksgiving meal include people from outside my household? Is it just from within the bubble? Or, is adding maybe an extra couple of people to the table fine? And I'm wondering if you can just kind of go over again what your specific guidance for this weekend is when it comes to who can be in the room and who should be remote.
Yeah, so I think I started it by saying, let's keep our celebrations this year large in thanks and small in number. And that reflects. So if you have a large family and your household bubble is quite large, then make sure you have ways to include others that you might normally have in the room with you remotely. Do it outside rather than inside if you can, which you can in many parts of this province at this time of year. Make sure you have enough space between people. Or if you're somebody who has a very small nuclear family and you've made a bubble pact with another family, then maybe just the two of you get together. What we really need to be careful about this year is not having those large family gatherings where we get people together from different parts of the province or from different parts of the country and have that weekend together, because we know that can inadvertently bring that virus with us, and that will put people at risk. And we really have to think about who we're going to include and how we're going to include them safely. So if there are elders in your family that you want to celebrate with, find ways to do it that keeps them safe. And that may mean doing it remotely. So the key this year is to keep things small, to keep things local, and to give thanks.
That's all the time we have for today. Thank you,
Dr.
everyone.
Bonnie Henry.
Very much.